about flies, rats and other pests, education campaigns in sanitation and community health care, an army of paramedics, often called barefoot doctors, trained in basic preventative medicine, went into the fields and the factories. Illiteracy and superstition faded. Attitudes were changed. Opium addicts and prostitutes were seen as victims of exploitation to be helped and rehabilitated rather than shunned. Within 20 years, opium addiction was eradicated, venereal disease was a rarity, and the epidemics beaten. Today, though, the emphasis is still on prevention. China puts a high priority on good prenatal health care and education, caring for the vulnerable in society, the very old and the very young. Although the most advanced techniques of modern medicine are increasingly available, traditional medicine, which has proved so effective over thousands of years, has not been discarded. The doctor has found that this young woman is carrying her baby in a breech position. With special exercises each day, the baby can be turned to a correct birth position. Western medicine has developed no comparable techniques. Part of the treatment also involves moxibustion, heat applied with smouldering herbs to special points on the body. It's a technique related to acupuncture. These traditional therapies have a long history. Ancient documents show medical observation and treatment in China go back 4,000 years. Circulation of the blood was understood 2,000 years before its discovery in the West. Infant mortality rates throughout China are now better than those of most comparably developed countries. 35 years ago, 1 baby in 5 died at birth or within 12 months. The death rate has now been cut to 1/10 that figure. In the cities, the improvement has been even more spectacular, and here, in the capital Beijing, they have a better infant mortality record than New York. We were told that much of the success of the public health campaigns is the result of the involvement of the people with the doctors and other medical staff. Throughout China's complex medical network, we were aware of a different value system in health care. Doctors, mostly women, are not well paid, but have a selfless, dedicated approach, and there is no vested interest in illness. This attitude extends to the nurses and other health workers. Everywhere in China, we were struck by the way in which the people in the medical profession work together, without the barriers of prestige or status, which so often disrupt doctor-patient relationships in the West.